What is a cerebellar stroke, and why is it so important? Imagine a sudden change in your balance or coordination that comes out of nowhere. That could be a sign of a cerebellar stroke, a serious condition that affects a small but vital part of your brain. The cerebellum is located at the back of your brain and is responsible for controlling movement, balance, and eye coordination. When blood flow to this area is interrupted, either by a blockage or bleeding, it causes a cerebellar stroke. This interruption leads to brain cells in the cerebellum dying because they no longer get enough oxygen and nutrients. A cerebellar stroke can happen in two main ways. One is an ischemic stroke, where a blood clot blocks an artery supplying blood to the cerebellum. The other is a hemorrhagic stroke, where a blood vessel in the cerebellum ruptures and causes bleeding. Because the cerebellum is so close to the brainstem, which controls vital functions like breathing and heartbeat, a stroke here can quickly become life-threatening. The symptoms of a cerebellar stroke often include dizziness, vertigo, and difficulty walking. You might notice unsteady movements, tremors, or abnormal movements. Speech can become slurred, swallowing may be hard, and you might experience headaches, nausea, or vomiting. Sometimes these signs are subtle or mistaken for other issues, which can delay diagnosis and treatment. Rapid recognition is essential because the consequences can escalate quickly. Though cerebellar strokes are less common than strokes in other parts of the brain, they are very serious. They account for about 1.5% to 10% of all strokes but can cause severe complications. Because of their location near the brainstem, swelling or bleeding from a cerebellar stroke can press on this critical area, leading to breathing problems or even coma. The risk of death from a cerebellar stroke can be higher than other types, with studies showing mortality rates around 23% to 38%. That's why quick medical attention is so important to prevent further brain damage or death. Many risk factors for cerebellar stroke are similar to those for other strokes. These include high blood pressure, diabetes, high cholesterol, smoking, obesity, and physical inactivity. Heart conditions like atrial fibrillation and narrowing of the arteries also increase risk. Substance use, especially cocaine, can cause blood vessel problems leading to stroke. Older adults, particularly men over 50, are more often affected. In summary, a cerebellar stroke is a medical emergency that disrupts blood flow to the part of the brain responsible for balance and coordination. Because of its proximity to vital centers controlling breathing and heart function, it can lead to rapid deterioration if not treated promptly. Recognizing symptoms early and seeking immediate medical care can make a significant difference in outcomes. Always consult healthcare professionals for personalized advice and treatment options, as individual cases can vary widely.